Hi, my name is Uttara Bharath Kumar, and it's my pleasure to be part of this discussion today. I'm a senior SPC and capacity strengthening advisor with the Johns Hopkins Center for Communication Programs, or CCP, and I've worked in different countries in Asia and Africa for the last 20 years with CCP. One of the country programs that I'm currently connected with is the Breakthrough Action Zambia program. In view of today's topic, I wanted to tell you a little bit more about family planning work that we're doing in Zambia and share some of what is happening in the context of COVID. Maybe there are things that are going on in your own countries that you might connect with. The family planning work in Zambia focuses primarily on the high pregnancy rates among adolescents 15 to 19 years old, and particularly we're trying to address social and behavioral barriers that exist in them for using modern contraceptive methods. Reaching young people with sexual and reproductive health information and services has been a challenge at the best of times. I think we know that. So based on the formative research insights, 3 different approaches were designed in Zambia. The first approach was the Adolescent Wellness Days that put family planning or contraceptive use for pregnancy prevention in the context of other health and wellness counseling for young people. This included diet, healthy activity, HIV and malaria prevention, and other information. This addressed the interest of young people, made them want to come and seek out services, and made it interesting. The second was training health workers on confidentiality and how to counsel young people without judgment. Health workers would take a confidentiality pledge called Nizi, and the adolescents knew that and therefore were more open to talking to health workers and opening up to them. The third was through a multimedia campaign called the Family Health Campaign, which had a slogan, "Life is precious, take care of it." This uses mass media, social media, and interpersonal events like roadshows, football games, etc. And this would draw the young people and encourage discussion and conversation around reproductive health issues, as well as modeling positive behavior. So when the COVID pandemic hit, a few key things happened. First, the Adolescent Wellness Days could no longer be held, as this required adolescents to actually come to the health facility. Not coming to the health facility had another problem. It meant no interpersonal counseling either, which they were receiving from the health workers. Collecting contraceptives is also a challenge because when they came, people were hesitating to come to the health center, and when they did make it there, oftentimes there was a stock out. While our service delivery partners are brainstorming on access and supply, keeping young people engaged, connected, and thinking about reproductive health in these difficult times is really, really essential. One way the program responded was by meeting the adolescents on platforms, non-contact platforms, where they felt comfortable. We shifted messaging to social media, radio, as well as some print, some video that could be shared on social media as well. Employing more creative approaches that appealed to young people, like comic strips on social media, developing a comic book that could be distributed with minimal interpersonal contact, and provoking different issues around reproductive health that young people can talk about. This gave adolescents something to do when they couldn't go out very much, and gave us a platform to continue to connect with them. We continue to brainstorm, and I'm looking forward to the discussion we're about to have today and sharing our thoughts and listening to your ideas as well. Thank you.